Hello, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate Rural Talk Radio Network, a subsidiary of Global Media Network, LLC. Our mantra is to educate, enlighten, and entertain. The views of the guest may not represent those of the host of the station. And I had two public service announcements, folks, before I forget, because I just realized I'm getting near the end of August. And September, right around the corner, and September is World Alzheimer's Awareness Month. Those of us who have been caregivers, those of us who live with someone who has Alzheimer's, we don't need a month. We lived it or do live it every day. If you have any memory concerns at all, please consult your primary care physician about your concerns. And the other public service announcement is September is also Suicide Prevention Month. If you are struggling, please contact your primary care physician for mental health references in your area. And if you are in crisis, please call the suicide hotline 988. And that's my public service announcements. I am excited, as always, about my guest, who is Ronald Gruner. He is author of COVID Wars, America's Struggle Over Public Health and Personal Freedom. Ronald Gruner had a 40-year career as a founder and CEO of 3 technology companies. Drawing from his business experience, Ronald published We the Presidents in 2022, a presidential history which explores how the policies of American presidents have affected America and the world today. Gruner has taken a similar approach in COVID Wars. In his latest book, Gruner discusses how deep divisions within America during the COVID pandemic affected our nation's death rates, personal freedoms, and national economy. And I want to welcome Ronald Gruner to Chatting with Betsy. Welcome, Ronald.
Well, thank you, Betsy, for the invitation, and I'm looking forward to our discussion today.
Yes, I am too. I did read your book a while back, so forgive me if I don't remember what I read. I read a lot of books for my show, but I found your book very interesting, and I know even in families, COVID has caused a lot of dissension, like people stop talking to each other, which I think is pretty terrible myself. I feel like we all have a right, for our opinion, but I just don't understand why people get so, it's like out of control, Ronald, and how people treat people. But before I get off track, I always ask the authors, what motivated you to write your book?
Well, frankly, Betsy, it took a while to get motivated to write a book about COVID because, as you pointed out, we published my first book, We the Presidents, in January of 2022, and that was a lot of work, and I was thinking about my next project. And we had all been through COVID. I had, you had, everybody had, starting in 2020 through 2022. And I just didn't think, I didn't have the energy, I thought at the time, to take on a subject as complex as COVID. But I had friends and a number of associates that suggested I should take a cut at that and look at that and try to write it in the same, I'd like to think, objective, nonpartisan approach that I took with We the Presidents. And what really convinced me to write it was, as I began to do some research, I realized that the Spanish flu, the Spanish flu of 1918, there was not a book written about that. That was really a definitive discussion of the flu and what caused it in the history and how it evolved until 1957, over 40 years after the flu itself happened. So it took that long for somebody to write a book. So I thought, well, we certainly don't want to wait that long for COVID. So maybe it would be worthwhile to try to write an objective overview of the COVID pandemic shortly after it occurred from the perspective of somebody, myself, and the people I talked to and interviewed and read about what they went through. And that's what motivated me to actually write the book.
How long did it take you to research, to write this book?
Well, it was about a 2.5-year project to research and write the book. And that was pretty much full-time. I'm retired. I retired in 2015, and I began We the Presidents in 2017. That was my first book that took longer. It's a larger book. But it was about a 2.5-year project.
Well, I think you did an excellent job on COVID wars, Ronald. I like the graphs, that you have in your book. And, there are some really bizarre, and I'm sure you've heard, rumors, I'm going to say rumors, misinformation about the COVID vaccine. And I'm sure you've probably heard it all in writing your book and researching for your book. I'll tell you what I heard. And people used to send me stuff all the time, that there's a tracking device in the vaccine. Now, I'm not saying this, folks, I'm just saying that this is what misinformation people sent to me. And did you hear that in
Well, of course,
interviewing?
Of course I did. I wrote about that in my book. There's a whole chapter, Betsy. There's a whole chapter in the book called Alternative Facts that deals with three or four of the major conspiracy theories that occurred during the COVID pandemic. And one of them was that the vaccine itself was some kind of developed by Dr. Fauci or Bill Gates or other nefarious characters at the global level to either reduce the population because of overpopulation or to sell vaccines or other things of that nature. And the idea that there was microprocessors, tiny microscopic microprocessors tracking people through the vaccine was one of those conspiracies. It was bizarre, very bizarre.
Yes. I couldn't believe the misinformation. I'm not going to say information. The misinformation that was out there. That it can cause infertility, it could cause cancer. I mean, any new vaccine that comes out, you don't know really the side effects for a while. I would think it would take at least, 1 or 2 years, if not more, for people to say, I had this side effect or I had that side effect. But to think there was a tracking device in the vaccine, I just can't even comprehend that at all.
Well, that is unbelievable. I mean, but, there's still tens of thousands of people, if not more, that believe the earth is flat. I mean, that's just unbelievable. And to believe that somehow there's a tiny electronic device in the vaccines that, if there were, you could get a microscope and, look for it, and if it's not there, then it's not there. But I tell you, Betsy, people that study epidemics and pandemics were not surprised that a lot of these crazy ideas popped up, because it's common during really severe crises that affect many, many people, that people try to find solutions and ideas as to what's happening. And so these theories pop up. They popped up. One of the books I read during my research was Daniel Defoe's diary of a pandemic in 1665 in London. And his uncle had written a diary living in London in 1665 when that plague came through and killed 100,000 people. And about 60 years later, Daniel Defoe, who wrote Robinson Crusoe, then wrote kind of a narrative history of that pandemic, including the conspiracy theories about where it came from and how it was affecting people. That was not uncommon, and the same thing happened in 1918. But what was amplifying the theories that you mentioned and many other theories was we had cable news and we had social media just broadcasting that day in and day out, and it divided half the nation. A good percentage of the nation believed many of those theories, including the vaccines were a conspiracy for various reasons and were killing people, not healing them.
Yeah, yes, I have heard that, and I know there was people where my son goes to socialize. I think 3 people died, 3 or 4, with his buddy night group. and it was just, a tough time. And I'll tell you what, Ronald, I don't understand why people had such a hard time putting on a mask. I mean, that's all that's asked of you, whether you agree with it or not. A lot of people say, oh, the mask made, people worse. You're breathing in germs or whatever. It's a simple thing to do.
Well, a mask became a symbol, Betsy. It became a symbol, and people that tended to support the advice of public health so-called experts, and they were experts. They were doing the best they could, that basically promoted vaccines and later mask wearing. They were viewed as one type of American, and people that wanted to resist that and focus more on what they perceived as their own personal freedoms and did not want to wear a mask or socially distance were another class of American. Those two divided America steeply. So it was more of a political thing than I think more of a personal issue. It was a badge of courage or lack of courage for those that chose to wear and not wear a mask.
I used to tell people all the time during COVID, I'm at the show, put on a mask. No one's asking you, like they did in World War II, to put on a heavy backpack and, get parachuted in enemy territory. That's why they were the greatest generation. All you're asked is to put on a mask. That's it. Mm. And I still see people wear a mask in stores, out in public. And my son will say, why are they still wearing a mask? And I said, well, maybe they have a compromised immune system, or maybe they live with someone who has a compromised immune system. You don't know. People still want to wear a mask. That's their choice. Doesn't bother me.
That's exactly right. That's exactly right. It's become a political issue, which is a shame. But, beginning at the beginning of the pandemic, I talk about this in my book. There's pretty much a chapter about the beginning itself. Cable, you have to recall that as a pandemic was emerging in early 2020, the country was very, very divided politically. President Trump had been impeached. It was an election year. The tempers were high. There's a lot of angry people politically. And so when COVID emerged, starting in February and March of 2020, cable news, and I'll be specific, primarily Fox News, says, well, this is a political hoax just to undermine the president in an election year. COVID is not that serious. As a matter of fact, it's not nearly as serious as the common flu. And this is documented. That's documented well in my book about that. And that began to divide people. And that was one aspect. But another aspect was, in some respects, public health, Dr. Fauci, who I think his intentions were absolutely the best, tended, frankly, to speak sometimes too much off the cuff. So he made a couple of quotes early in the pandemic in February saying, at this time, masks are not necessary, but they may be necessary in the future. And so the media simply picked up on the phrase, masks are not necessary, and began to talk about that. So that caused a lot of confusion. So when he came back in the March and April time frame, we're saying you do need to wear a mask. People really did not. Many people did not believe it. But people have used, Betsy, the notion of the Swiss cheese. You've got vaccines, you have social distancing, and you have masks. And none of those are perfect. A mask will not keep you from getting COVID or giving COVID, nor will social distancing. Vaccines go much, much further. But you put the three together, vaccines and social distancing and masks, you're much, much safer and much less likely to get sick from COVID or pass it on.
I also know, Ronald, that people were at risk. There's, people who were diabetic, overweight, had heart conditions, already compromised immune systems, were at very high risk for getting COVID, and were encouraged to get vaccinated for it. I would encourage people, do what you think is right for you. Now, my son works on a school bus, so he had to be vaccinated. I personally have a lot of side effects with different vaccinations, so I chose not to be vaccinated. It had nothing to do with politics at all. I just did what I thought was right for me, and thankfully, not that I know of, I did not contact COVID. Basically, lived in the house and just went out, to go shopping for necessary things. But I think that personally, people have to do what they feel is right for them. But if you are at a job and it's mandatory, then you really don't have a choice. Now, a lot of people didn't like that, having it mandatory. What is your feeling about that? I know you probably have it in your book, but what is your opinion on that?
To just say it as simply as possible, I think President Biden made a mistake mandating vaccines in 2021. I think we should have done as a country a better job educating people and letting them understand what the issues were. I think that they tried their best to do that, but there's a lot of people, as Biden, for example, was talking about the benefits of vaccines and why people should be vaccinated. Other people, basically because it was politics that was undermining so much of the communication going on during the pandemic, who were saying, we don't want to be told about vaccines. We can make our own decision. We can get our own information. We don't need the government telling us about this. So it was a highly politicized time, and that was a factor. But I think that it was when deaths were spiking so much in the summer of 2021 and September of 2021 that Biden, I think in frustration, said, well, we're mandating masks for a broad area of the country. And that had a very negative reaction within many areas.
I have to tell you, Ronald, I interviewed emergency room doctors on my show, and the amount of deaths and the nurses saw was so, I want to say, out of control. They weren't used to that. It was like being on a battlefield. That they had mental issues. Their mental health was going into post-traumatic stress because of seeing all this death around them. Did you cover that in your book?
Yes, I did. And there was a very good book written by a nurse who was in the COVID ICU in Boston, at one of the major hospitals in Boston. She did not name the hospital. And I know who it is, but I'm not going to mention that. But it's one of the top hospitals in the country. And she wrote about what that was like as on the COVID floors in the first 6 or 9 months, or the first year of the pandemic, and how horrible it was and how people were dying. They really couldn't treat them. It took a year to really learn how to treat COVID, and just for the symptoms and to help them breathe, for example. So I did write about that. And I closed with her comments, which I still find very emotional. I closed the book with her comments in that book about what it was like being in the medical field and being a staff nurse trying to save people's lives. That was a very hard thing. And most people weren't exposed to that, so they don't know what people went through. But if you talk to people that dealt with people that had COVID and how sick they were, none of them denied that it was real, that it wasn't real, or felt that if there's anything you could do to keep from getting COVID and passing it on, you should do that. I think 99% of all physicians and medical people believe that.
It was a very difficult time. I even spoke to someone, a funeral director, and what his experience was, how they had to put on he called it almost like hazmat, suit to deal with to handle the bodies of those who had COVID. It was really a tough time, and I could tell you and the audience on a personal note, my older brother, he didn't have COVID, but he died during COVID, and we couldn't visit him. And that really hurt me. And I was thinking, what was my brother thinking that nobody was visiting him? And thankfully, my mother and my younger brother were able to be with Bradley when they knew he was going to die, once they removed him from life support so he didn't die alone. But there was a lot of people who, and that's just so emotional, like you couldn't be there to say goodbye. You couldn't have a proper funeral that you would normally have had, or a wake, or whatever, memorial service. Some people had to wait 6 months to a year afterwards. That's really difficult. I mean, my brother's funeral, there wasn't that many people. My brother was well known in our hometown, and a lot of people didn't visit my mom afterwards because of COVID. It was really such a difficult time.
It was,
emotionally.
It's hopefully a time we'll never have to go through again if we develop modern medicine and we can avoid these pandemics that we've had roughly every 100 to 150 years. The Spanish flu, the London pandemic, the Russian flu. I mean, those have been epidemics and pandemics that come typically every century or so, sometimes more often. But with modern medicine, like we, for example, have smallpox we've eliminated, and maybe we can eliminate these kinds of viruses and epidemics that wipe out small parts of the population, like you're talking about. Let's hope that happens. Let's hope we keep spending on science and health at the government level and the private level to do the research necessary to make that happen.
Yes, and speaking of vaccinations, and I'm sure you have heard this in the news, that the measles is coming back, which, I remember being vaccinated for twice, once as a child and once in high school, because they said the first vaccination that I received wasn't it wasn't effective. And
they had a second-generation vaccine, what was better, about 10 years later, and so that's probably the one you're talking about, the Savin vaccine, the Salk and Savin, I believe it was. Salk was the first one, I know that. Yes, that was about 10 or 12 years after the first one came out. It was just the first one was still very effective. If you look at the drop in smallpox cases, they dropped very steeply in the mid-50s when that came out. But the second one was even better, and that was the one that was the final one.
Yes, and I can't understand, why parents are not vaccinating their children for measles. And I know there's a lot of controversy with vaccinations and autism. I'm sure you've heard that too,
Well, but I think that, Betsy, it's been, I'm 78 years old. I remember the childhood diseases in the 50s, and I remember once, very, very occasionally, not often at all, children our age when I was growing up would die of the measles or some childhood disease, diphtheria, for example. I mean, that did happen. And but nowadays, up until at least recently, very, very few children died of childhood diseases. They've pretty much been totally eradicated. So we've become inured to that and saying, well, it's really not an issue. And so that's why people are looking at, say, vaccines and saying, well, there's a risk of autism or there's a risk of other issues, so I'm not going to do it, because they don't perceive the risk that's there if they do get these childhood diseases again. So we've become complacent, unfortunately. And, of course, you've got people, frankly, in my opinion, crackpots that are talking about all these issues with vaccines with no proof. Now, they do have a point in some respects in that there are issues that have developed. Autism, for example, appears to be far, far more prevalent now than it was 50 years ago. Some people say it was just misdiagnosed 50 years ago as we didn't diagnose it correctly. I'm not sure of that. But there may be things in our environment that are causing some of these issues that we're dealing with now that we didn't know about or didn't think about or didn't have 60 years ago. Autism is probably the most common example we discuss.
Yes, yes, it's getting diagnosed much more now than even 40 years ago. Um, I also wanted to ask you, and I know you have it in your book, which states did better with the COVID, dealing with COVID, having a lower COVID death rate? Was it the red states or blue states?
Well, I did a lot of analysis in that in the book.
Yes.
The book has almost 100 pages of appendices, in other words, tables by the state and the country level regarding that. But to answer your question, unfortunately, the red states had a significantly higher death rate than the blue states. And, I hate to even talk about the country that way, red and blue. I mean, we're so divided.
Yeah.
I hate to use that term, but nowadays it's hard not to talk about what's happening in the country without dividing us into two segments, red and blue. But the red states, even before the pandemic, had a lower lifespan than the blue states. States like, for example, and I'm just picking two at random. For example, Massachusetts and Mississippi, two states that begin with M. One's a blue state, a very blue state. One's a very red state. Their life expectancy in 2019 before COVID differed by almost 6 years. So life expectancy in Massachusetts was in the range of 80 years or more, slightly more, and in Mississippi about 74 before the pandemic. So they had less health care coverage. They had greater issues with diabetes and obesity in Mississippi. They had more maternal deaths in Mississippi and other red states, and so the population was more vulnerable. Furthermore, the red states tended to resist vaccination. The vaccination rates in the red states were significantly lower than those in the blue states. Some of the blue states had vaccination rates approaching over 80% by the end of 2021, or certainly the end of 2022, over 80% in the blue states. And some of the red states had vaccination rates that were barely over 50% at the end of the pandemic. That's a large difference. And if you analyze the states, and I also analyzed at the county level, there's over 3,000 counties in the United States, and we're blessed at this point to have very reliable and solid information, statistics about what happens within counties in terms of economics and health and education. And I use those statistics to do that analysis. And that extreme between the red counties and the blue counties is even larger than it is between the states, because even a very blue state, let's say even a very red state, for example, like Texas, has major portions, namely Houston, Dallas, Fort Worth, for example, that are largely blue in terms of their politics and their thinking. So there was a very large disparity, and that's why on the cover of my book I've got a picture of the United States divided down the middle, because they were divided politically, medically, health-wise, death rates, in many respects, and it broke down politically.
Yes, it caused a big divide. I have to tell you this. It's kind of a funny story. I like to throw those in when I do a show. My younger brother, when he had Thanksgiving, this had to be in 2021 or 2022. He asked people to send them their vaccination cards. He wanted to make sure they were vaccinated before they went to his house, because he didn't want our mother exposed to anyone who wasn't vaccinated. So, I mean, some people, that's his house. I understand. I don't drive out there anyway, so that was, fine. But I just thought, I don't know. Do you think, is that going a little overboard, or is that just, it's a personal preference, I guess?
I don't think it's going overboard. If my mother had been living during the COVID pandemic, she would have been in her early 80s, and she had some health conditions, and I would have said the same thing. I said, she's fragile health-wise, and we don't want people coming in with a bad cold or potentially COVID. And you have a much less chance of coming in with COVID if you've been vaccinated. So I would have done the same thing. I'll give you an example. Before, make a long story short, before the COVID pandemic hit, my wife and I had scheduled a cruise from Vancouver up to Alaska on a cruise to Alaska on a cruise ship. And, of course, we had to delay that because of COVID. So at the end of 2021, we took that cruise. And but the cruise line still required everybody to get a COVID test before they would let them go on the ship. And we had no problem with that, and I think most people did not. But what was astonishing, still, I asked the nurse who gave us the COVID test, I asked her, how many of these tests do you give a day? She says, I give about 40 a day. That's about 5 an hour. So they move people in very quickly. And I said, well, what percentage actually have COVID today that you test? She said about 5%, which is amazing. 5% of the people walking around a year and a half after COVID began still tested positive for COVID. So that was still an issue. And that's why people like the cruise lines, except in some states like Florida where they were not allowed to do that, but other areas like Washington State and Alaska required that, they found a number of people that had COVID that would have gone on the ship and could have caused problems.
Yeah, that's that is food for thought there, Ronald, because you could have COVID or be a carrier, I guess, and not even realize it. I have a lung condition, and where I cough. I have some kind of weird variant of asthma, and I would get dirty looks wherever I went. And one time my son and I were at the movie. I would get dirty looks. Yeah. And one time my son and I were at the movies. So when I eat or laugh, I cough. So I was coughing. And a manager came over and he said, can you come out? And he goes, people are complaining that you're coughing. Can you leave? I said, no, I'm not leaving. I don't have COVID. I have asthma. I have an asthma condition. I said, do you need a doctor's note? And he goes, no, just, sit by the side, when you come, next. And I was. I always had an end seat and try not to sit next to people, and I would try not to be near people because of my coughing. But they just, jumped to conclusion, you have must have COVID, and I don't. And this was even like after COVID it wasn't as much a pandemic at the time. This lady came over to me after a movie. She said, next time, get up and walk around or leave. It's not all about you. And I said, for your information, I have a lung condition. I don't have COVID. I have a lung condition. Yeah. And, I would never go up to someone and say something. You don't know if they have a condition. What else do they have? Emphysema or COPD or, God forbid, lung cancer. If anything, I would say, Are you okay? Do you need a cough drop? Some water? I mean, even when I do interviews, I cough. I can't help it. It's just amazing how people just, jump the gun. Even with taking my son to the doctor, and I was coughing, the doctor said, you shouldn't be in here. Do you have COVID? Now, you would think she would know the difference between an asthma cough and a COVID cough. And I said, I don't have COVID. I have asthma. If you want me to wear a mask, that's fine. I probably did have one on. But when I'm coughing, I can't wear the mask. But, there's a lot of people with different conditions around that, they have a chronic cough. Thank God I didn't smoke, in my youth. But that's why I really, Ronald, during the height of COVID, I stayed away from crowds. In the stores, they were only limiting, a certain amount of people anyway. But if people were looking at a particular item, I waited till they left. I did not want to be near people.
We did the we did the same thing. I mean, particularly in 2020, the first year of COVID. I mean, most people, if they were fortunate, they could work at home productively. They were home most of the time. And when you go out at the grocery store, you would tend to. I mean, why would you stand next to 5 or 6 people if one of them might have COVID? So I think people tended to do that, keep the distance, so to speak. But yeah, it was a difficult time, and there was a lot of people that really didn't quite know how to behave or what to do, and many people were just scared. I've lost a couple of, no family, but friends to COVID, and I know one person that got long COVID. It's set him back 18 months, and he's still recovering from that. That's been horrible for him. It's caused him a serious heart problem, myocarditis, it appears to be, and that was a bad situation.
Yes, there's. I interviewed someone right at the beginning of COVID, a pharmacist, and that had to be 2021, because it was right after my brother died. And I asked the pharmacist, are they going to retweak the vaccination every year? Which now I think they are doing. They're, tweak it just like the flu vaccination. And the long COVID, a lot of people are having difficulty with the long-term effects of having COVID. And I guess it, depending on how severe you had COVID, depends on your long-term. If you were on a respirator, you probably are at more risk of having more problems, difficulties after you recover.
That's true. Although I know people that got very, very sick and actually were on a respirator, and once they got well, they were fine. No aspects of long COVID at all. I think I can think of several people that were quite ill and recovered completely. But I know one person that got a case of COVID and went away after about 10 days and was okay, appeared to be okay, and then several weeks later began to get various symptoms and particularly a heart condition, and that's what has set him back for almost 18 months now. And it came kind of out of the blue, and they diagnosed that as having been related to COVID, because the COVID virus gets all through your body and into your heart system and kind of clogs up parts of your heart and your body, and that's causing that kind of a problem. The other thing about COVID I mentioned in my book, I beg your pardon, long COVID. Long COVID is not just one thing. I mean, long COVID is how your body's been affected after COVID. It might be a heart condition. It might be a liver condition. It might be a pancreas. It might be mental fogging. So there's no specific symptom for long COVID. It's just a set of problems that are almost random in terms of how they might develop on a personal basis after COVID. So doctors are having a very hard time treating it because there's no single treatment.
Yes, I have heard that, and everyone's different. Everyone's body reacts different to getting, illness. Just like with everyone responds different with vaccinations. Somebody may not have any side effects. Somebody might have side effects. I recommend if you have any type of vaccination, you have any side effect, you need to contact your primary care physician. You need to report it. And you could also probably report it to the Drug Administration. They like to know about these, side effects. What challenges, Ronald, did you face in researching and writing about such a polarizing topic?
That's a good question. I wouldn't say I had, really challenges. There was a lot of data. America is blessed with having a government that provides a lot of data for people that want to use it. The Internal Revenue statistics are available. Public health information is available with the CDC. Crime statistics are available. I'm an engineer. I spent my life as an engineer. That was my career, and later as in management, technical management. So I tend to be kind of a numbers guy. For better or worse, I'm kind of a numbers guy. I enjoy that. And I would put together analysis, typically just based on spreadsheets that would do what we call correlation, analyzing, for example, let's just take a simple example where we take the states, and we have two databases on the states. One is vaccination rates, and one is, death rates from COVID. And you can compare the two and just see what the sensitivity is in terms of what the percentage of people die based on what percentage of vaccinations a particular county has. And that was the kind of thing I did for 2.5 years that I wound up using in the book. I guess if I had any challenges, when you first go into something like that, Betsy, you're not really sure exactly what questions to ask and what kind of, quote, research or data analysis to do. So you start with something that seems obvious, and you learn a little bit from that, and then that raises other questions, and that raises other questions, and it kind of takes you down a long, long path about how much data analysis you actually want to do, because you do learn about what the sensitivities are and what you really want to focus on as you proceed. And you could do that, I could basically continue another 2 years to do analysis and working on revising that book. And so you have to know kind of when, okay, I've reached the 90% level where I think any more effort is only going to yield about 10% more benefit, to try to put an arbitrary number around it. But that's a challenge in doing analysis, and writing a book is kind of knowing when to quit. Because you ask any author, and I know you've spoken to many, and they'll tell you, you write a chapter or even a paragraph that you think is in very good condition, you set it aside for 2 days, you come back, and you make edits. And that's just you see things, how did I do that? I could make this better. I'm not talking about spelling errors. I'm just talking about just improving the language and how you present the ideas. And that's a challenge in writing.
Well, I'll tell you what, I really have a new appreciation for writers since doing my show, because, we take so much for granted, picking up a book, reading it. But if people would realize the research that goes into a book, I like asking people about their writing process. It's just fascinating to me. And I found COVID Wars, your book, very informative, very interesting. And, when I received the book, I was like, I don't know if I'm going to be liking this book. But I did. I did like it, and I highly recommend for people to read it. What would you want the readers to take away from this book, Ronald, after, COVID's kind of calming down now? One can only hope. I think it is.
Well, a couple of thoughts. The first thing is there's a lot of uncertainty and suspicion about our medical systems and public health, and who to believe and who not to believe. And what I suggest to people is I point out that we're blessed in the United States with having some of the best medical institutions in the world. We have the Mayo Clinic, for example, in Minnesota and Arizona and Florida. We have the Cleveland Clinic. We have Massachusetts General Hospital in Boston. We have Stanford. We have great hospitals in Houston. And so and I'm trying to be candid with people. If you don't trust public health facilities and the government or the pharmaceutical companies, go to these major hospitals, and they have websites, and they provide valuable information that I think is the best information available. So if you have doubts about vaccines, do your research not with individuals or writers or social media. Go to the big hospitals and their websites and see what they say about that, and the big institutions like Johns Hopkins. We're blessed with that. So that's the first advice I give to people. God forbid if this were to come up again, or if they have any questions, medical questions, that's the place I would start.
That's a very good advice. Now go to a source that you can trust and have confidence in. At some point, Ronald, people say, I don't trust doctors, I don't trust the healthcare system. Well, you got to trust someone some information, right? I mean, you can always be a skeptical about things. Go to your teaching hospitals. That's excellent. The Mayo Clinic, just like you mentioned, the hospitals that John Hopkins. These are major health institutions that have been around for many, many, many years. And if you can't trust what comes out of those, forget it, right?
That's correct. That is correct. People come from all over the world to go to these institutions.
That's right.
Before COVID and today and during COVID. And so we're blessed with that. That's the place to go. I would not say if you want to really, answer questions about COVID, I mean, read my book, but my book is nothing compared to what's available with these top medical institutions. They're the experts. They're the experts. And
Absolutely.
That's, if you have questions about do the vaccines really work, they're the place to go.
Yes. Yes, I agree. Ronald, where can people purchase your book, COVID Wars, America's Struggle Over Public Health and Personal Freedom?
Well, it's available in bookstores around the country. If the bookstore does not have that, they can order that. They'll know how to do that, and you can get the book delivered to the bookstore in typically 3 or 4 days. So that's one place if you shop in bookstores, and of course it's available online in many different sites. Amazon, obviously, it's available at. If you just Google COVID Wars, Ronald Gruner, lots of sources will pop up after you do a search. But bookstores, Amazon, Apple, if you like audio, for example, even Walmart, places like that online all have it.
And how can people connect with you? Do you have a website?
Well, that's easy. That's easy. If they'd like to chat with me over email, I'm happy to do that. My website is ronaldgruner.com, ronaldgruner.com, my name. And there's a contact form on that if they can basically raise a question or contact me through that, and I respond to all emails. I don't get thousands of emails, but I get enough that I try to respond to all of them.
Oh, that's great. It was such a pleasure talking to you, Ronald. I hope your book does well, and I think people should read it. I really recommend reading this book, folks. I'm going to say it again. COVID Wars, America's Struggle Over Public Health and Personal Freedom, Ronald Gruner, and you spell the last name Gruner. And I enjoyed chatting with you today, and thank you for coming on my show, writing your book, and talking with me today. I enjoyed chatting with you.
Well, Betsy, thanks once again. Thanks for the invitation. It was a very interesting hour for me, too, so I enjoyed it. Thank you very much.
You are welcome. And, folks, all the information about Ronald Gruner will be in the blog that Jeannie White, who's the station manager, writes, and Jeannie produces the show. And I want to thank Lorna Caldwell, who's CEO of Passion World Talk Radio Network, who makes this all possible. And I want to thank you, the listeners. Please share the show to help people. We need to learn about what went on during COVID, what we can do to make things better, God forbid if we have another pandemic. And this is a very interesting, very informative book that I highly recommend. And if you don't already subscribe to Chatting with Betsy, please do so. It's for free. I'm on Amazon Music, Spotify, Spreaker, iHeart, to name a few. And you could program Alexa to Chatting with Betsy if you have Alexa. And I also want to let you know you could follow me on Facebook, Betsy E. Wurzel, Wurzel. And you could take a glimpse of my personal life on Facebook and see what I am all about. And really what you hear with me on the show is what you'll see on Facebook. I'm just being me all the time. And I want to thank you all for listening and spending time with me today. This is Betsy Wurzel, your host of Chatting with Betsy on Passion World Talk Radio Network, a subsidiary of Global Media Network, LLC. As I always say at the end of my show, in a world where you could be anything, please be kind and shine your light bright, because we need it now more than ever before. Be safe out there, folks, till I chat with you again. Bye-bye now.